Ja, erstmal vielen Dank für die Einladung.
First of all, thank you very much for inviting me. I send greetings from Weber, and delighted to be able to speak to you today. And for those who have prepared this event, I would like to first of all say a few words as to how I've come to this point to work with this theme of disability and trauma. And I would like to go into one or two aspects. Our work with people with special difficulties in our place, because we are convinced it's a not only conviction, but it's a reality that and how we can work with this out of this discipline and the experience which we from our training group that we have until now has not been sufficient developed and accompanied regarding the needs for this group of people. We have made the experience regularly that also when we are challenged by the behavioral difficulties of people, that we have a great difficulty also for those who are caring for these people. And that's a big concern that we can really develop our work with trauma therapy with this group of people. So here in Weber, we have working with this trauma education. I became active in this in relation to the kindergarten. It came that I met two sisters who came with 5 years old, and they were so difficult to hear. The children were where we in my study, I have never heard one word about trauma, and I think it's that we have no knowledge of trauma therapy, trauma education in that time, and it is a chance meeting with a university person that I then, first of all, in the 1990s, could actually learn about this subject. And so I then got a first idea of what was possible with these 3 children that we were working with. And so we worked in a very, very naive way on the subject to develop this this work in education. Up to know from your own experience, this is not met with a lot of appreciation in the therapeutic realm, and of course it is a nationwide understanding is not yet there. And there's but then comes as a spontaneous reaction that this is not madness, it is a lack of thought. And in order to build our knowledge, we need to be able to accompany them and offer help in as the way we would like to do, and that's why we can also look this in terms of the educational field. Meanwhile, more than 25 years have passed, and the theme of trauma education has developed. From the right through to helping older people. And I'm very glad about this because it's very moving because we find this in many places, that this theme of trauma, as we understand it, we want to what also became clear later to me as we've experienced, is that this theme is not so new. In 1924, I wanted to take on something similar. He had a theory of psychoanalysis where he tried to ask in relation to the educational work, and had also made experiences that that there was a real advantage for the educational work on site. And already in Vienna University had worked out that the psychic trauma is what's responsible for is that children is the reason for the behavior of children. We would then refer to his behavioral challenges. So that was almost 100 years. There was the knowledge there that psychological trauma had an effect on child development. And that's why it's necessary in our educational work to work with this. And he has also pointed to the fact that there's interdisciplinary approach is needed, and he perceived it then and decided that movement that is one that it was felt to be extremely important. So you see with these two quotes, it is an old theme of educational work. That this whole theme of trauma was not actually included in the profession at the time. So let's now look at a few thoughts regarding the theme of disability. From my knowledge, after many discussions with colleagues, I'm convinced that already in the language, something which what we've met in terms of violence is, and I have simply put a few things together from the last So today we're speaking of mental handicap, and it is all an attempt to try and understand those who are affected. So this is a worldwide association. This is why I would like to take this concept further. Very important layer in the course of my meeting with such people is the wish to understand the needs, how he or she has developed a picture of themselves. I have made personal experience in this, where we could I found that there is a consciousness of oneself,
zum Verständnis für pädagogische Arbeit und Zielsetzung ist. Eine wunderbare Dokumentation.
Wonderful documentation.
Eine Filmdokumentation über das erste Ehejahr eines jungen Paars in Trisomie 21 zeigt,
Shows on various places.
Seid ihr einfach behindert oder wie versteht ihr das? Geben Sie zur Antwort. Nein, behindert bin ich nicht, ich sitze doch nicht im Rollstuhl. Oder der junge Mann.
The young man, and then he answered, "Oh, only sometimes, but it's difficult in another way." This is something which they'd experienced their daily experience, where in his experience, and also from his social surroundings, he could meet he wasn't able to come to his own realities, and that is something which I have to bring into consider in my educational work. Or perhaps another is another one, Veronica Heider, who is an academic who says, "I am self-determined." A young woman who, because of a disability of autism, who's always dependent from outside and doesn't come to her own self-determination. And one small example from my practice with an 11-year-old boy. He we couldn't explain what his behavior, and the children were very tried to build a relationship to him, and the boy also reacted with a strong resistance to all these efforts, until one day, in a personal conversation, one-to-one, it then appeared what adults were important for him, what they could do, what they could offer him. And he said to me then, in a sentence which was, I remember, a good adult is one who can drive a tractor. So we had a value system where he considered the meaning of an adult, and driving a tractor meant there was a good person. And that is something which I need to know in my educational work, so that then an educational process can really start. And the knowledge or that made every conflict clear, and that helped also that the colleagues could start to learn to drive tractors. And then from this knowledge, then all my colleagues then had to get a tractor license. What I wanted to make clear with this is that it is an important task from our side that we meet the people and understand them in their own position. And for this, it needs a great amount of interest and openness, and interest in finding out and trying to understand who you are and why you think in the way you do think, because that is a process which is regardless of where you start from. That is something which a person, that every person is looking for an image of himself. So it becomes clear in this place what we are also doing, but what we've made in our experience, that the theme of disability is basically is actually a theme of social exchange. How does the social surroundings relate to the individual person who's affected? And so that is why I've written this up in this way, that it is the social reaction which creates the idea of being disabled. And this understanding of disability is also coming into the professional field too. And you see how clearly that a first aspect of how people with these difficulties that we're always meeting, that they are understood as people are not as they ought to be. That, of course, runs counter to the thought that and that we are simply trying to bring them into our way of thinking. The fact is that they also belong to us and need to be integrated, but that they are what is it they belong. This is a colleague of mine. You have to have mediated to one if one's going to be disabled in order to know that one is disabled. So disability is a social issue, and this affects in mental disability as well, or leading to exclusion. A very exciting thought experiment was carried out by one of the professors with us in 1987. What would happen if we if we go through town. So universal scientists so what does explain as a universal statement of understanding life? And when this question was presented, what would you think if you want to take your disabled person through the pedestrian precinct? So long as we cannot prove that none of you have the solutions in their head after which Hawking is looking for, we must treat everybody as geniuses, even if they are heavily disabled or appear heavily disabled. So he's made this because there's always certain pictures, certain expectations, certain conclusions are then drawn on this particular person, and therefore bring them to a difficult position. I said before that groups of people who form a high vulnerability group. So we have also found in our studies that the 3 or 4 times higher risk of repeated victims suffering from stress and violence. More exactly, we see the difficulties of people we have this formulated no person would have come to the idea of harming himself because he was stressed, but that is the assumption that was made, that a disability is assumed is basically something which has to do with stress. And they have worked with this for many years to try and make this clear, to have a kind of predisposition to this condition. And it is also very clear that in the educational practice, there are too few examples. I don't know how it is with you, but in the region from where they come, in that area, it is almost hopeless to many institutions there is we have some trained educational team and that of course is a condition in other fields as well.
zeigt es sich weltlich eigentlich, dass diese Hochrisikogruppe von Menschen an der Stelle viel zu wenig
It is far
Support
too little psychological support.
Therapeuten,
I know many therapists
zum Beispiel die Position,
who have the position
mit ihm
that
oder ihr kann man therapeutisch nicht arbeiten
that one cannot work with that person therapeutically.
und kann nicht mit ihr kommunizieren. Was eine Fehleinschätzung ist, aber das
What I believe, however,
später nochmal darauf.
we'll come back to.
Also ein erhöhtes Risiko sowohl
So there's an enhanced risk
als auch
of developing
Opfer von
further
Erfahrungen zu werden.
problems.
Im Grunde von Anfang
And so from the beginning,
eines Kindes, was eine
the
Person aufweist,
that a child who has this is actually showing a kind of over demand and pre-traumatizing or psychic illness of the parents. Many the disability of the child can therefore be a special risk factor when even from this more parental stress and helplessness results. The cause for this could be regular child disturbances, uncontrolled behavior, enhanced danger of accidents, greater health risks of the child, and a burden on the care and the communications with these children. And so it is actually a consequence. My colleagues in 2008, we came to the point of which actually is the cause of many traumatization of people with spiritual disabilities is the spiritual disability itself. So and that is always the case which we can observe, particularly in the period from to the school. So we had a child who had strange complexes and had anger cycles, who always came to his limits, who then was observed very carefully for special educational and identified as having a mental handicap. That means that whole biographies are massively influenced by this. Now, the person affected is then nothing can be done. That then, of course, we can see that it is not. There's no strategies for overcoming this stress, even if it's very small. There's a lack of coping strategies against stress and fear. Countless small micro traumas, stimulation weakness, ununderstandable communications and interaction behavior, limited emotional practical adaptation to the outer life situation, and continuous over demands on learning. If we cannot make oneself understandable and cannot be understood from the surrounding, a condition which is none of us can actually manage over a brief period. Just imagine yourself. you sit in a train from Kassel to Hanover, and you have to have an important discussion. After you just try to keep being cut out on your communications. That is so annoying. And when it's so difficult to understand one another, then of course it is not surprising that we have this kind of lockdown syndrome. But in the daily life, we have this experience that one is just simply not understood. That is what happens. When we speak about trauma, trauma is always seen as a huge, is actually to be understood in relation to stress. That it is right at the end of all kinds of stress developments. And of course, we then come to difficulties to orientate in life, such as to come to be able to stick by what one is learning. And so another explanation from the traumatic stress Professor Personal from Frankfurt has described, where he speaks about the autonomy development under difficult conditions. A damaged autonomic development as a consequence of traumatization. And so the understanding also in the socialization problem that the damaged autonomic development causes the trauma. And what be seen is that conflicts of typical resistance you only find in a hidden way. For instance, only in the fact that one is not able to do something. So that is like as a symptom of stupidity. If I think I'm stupid, then I'll be left alone. Where I can actually continue to move in my own comfort zone. So this system
verarbeiten, bearbeiten oder vermeiden möchte. Und so sprechen wir zum Beispiel von dieser umfassenden Stressfaktorenmauer, die Menschen mit Lernschwierigkeiten
please have a look at the bottom left. We start in the pre-birth realm of trauma, when the parents first, that they think that something is wrong with their as yet unborn child. That then continues further. The necessary connection to the primary person makes the disability stronger. And then, of course, you have invasive medical interventions until you come to the continual leaving out and devaluing. And then, of course, there are don't have a proper understanding of this situation because they see this because they are not able to do anything. And so in this place, we have in the biography, we come down to a breakdown of various kinds in the biography.
Diskriminierenden Charakter haben können. Das hat er vor 20 Jahren geschrieben.
That's what he wrote 20 years ago. That disability means for a whole life to be subject to the discriminatory character, to be easily discriminated against. Disregard as a fundamental experience of people with disabilities. So that is a devaluation of a person's life that we experience every day. It is also an exciting story that we are in a society which allows simultaneously in the diagnosis and about inclusion. So two themes which couldn't be different from one another, they are simultaneously discussed. A condition which one has to just let go because there is no mention of the person concerned or the condition of our society. Even today, an important theme. Are we really set up as a social construct? In various articles of the last years, for certain conditions for growing up of such people, that if we, I don't want to go into all these things, but all these groups, we also find in the description of symptoms that doesn't mean that everybody is automatically disabled, but every somatic experience leads to somatical rounds, but there is the risk with this group is increased. And there is a high degree of people whose disability is described. So the question is, the questions about is there a toxic poisoning already in the womb present that the person develops becomes alcoholic as a kind of relationship. So that is something one can look at.
Ja, aus welcher Perspektive die betroffene Person, die diagnostizierte Person, die Betroffene beschreibt an der Stelle. Also es ist immer,
so it is always
auch nicht vergessen, immer eine subjektive
so it's always a very subjective evaluation
im diagnostischen Prozess.
in the diagnostic process.
Gut, hier
And here again, an indication
auf eine Definition von Trauma, die wir als sehr hilfreich halten. Ich möchte gar nicht großartig drauf
those that are go into further. The important thing on this place is the last sentence. The traumatic events affect the entire social network, that people generally have the feeling of control, belonging, and a relationship system and a sense for life. So what is it that is necessary for people to be able to be in control of the situation, a sense of belonging, and have a relationship, and that it has purpose and meaning? So we can say in this place, in relation to trauma, we have to do with consequences, which is not only going to affect one person, but also its whole social context. So trauma makes one lonely.
Der Kern von Traumatisierung besteht in extremer Einsamkeit.
So whoever is affected by trauma is extremely lonely.
Wenn wir nicht langsamer sprechen könnten, damit unsere Dolmetscher besser hinterherkommen. Das wäre großartig.
Alles klar.
Vielen Dank.
Ich bemühe mich schon langsam zu sprechen. Okay.
Danke.
Also, das heißt, diese
So
Begrifflichkeit,
the concept which we have arrived at,
den kann ich eigentlich aus pädagogischer Perspektive,
that is what I can do from a pedagogical perspective. We could not follow, because it is not a disorder of the individual person, but is wider. That if we look at this graphic, that this stress curve is based on our normal experiences. The
Jeder Mensch verfügt über dieses
everyone can access to these levels of different stress,
wirksam ist und was aus zwei wichtigen
and it is made up of two distinctly distinguishable areas. There's a very controlled area, and directly next to it a field, a much larger area of uncontrolled area. And so this aspect of the controlled area, so the green area is even narrower in those who have to deal with anxiety and stress. What I have for a long time, what is something that young people are not able to do so easily.
Sobald wir wechseln in den unkontrollierbaren Bereich, verfügt unser Stresssystem.
So in this uncontrolled field, we have this, there's all these various reactions that take place. So in this area, so in this explicit form from fighting or fleeing. And that was a good understanding that this stress is not only affecting our psychology, but also has a consequence for life. And the supply of stress, the coming about of stress, has further effects. And what is important for the education evaluation is the knowledge of this,
in der pädagogischen Begegnung. Gelingen Kampf oder Flucht nicht, dann
if one cannot escape by fleeing, then everything becomes much more serious and the organism locks down, and then you come to this about the freezing and fragmentation. And then the soul carries on what the body can't do. This fleeing away on another level, what the body can't do. And that was a very important acknowledgement, which then happened in our own studies, because until then, we had not considered, is a person is still in the controlled area, or is he already in an uncontrolled area? That has consequences on the educational work. It has consequences as to whether it is necessary or makes sense to intervene cognitively or actively. So that means that it's determining what kinds of pedagogical interventions make sense. And we have noticed that it makes no sense for somebody who's in an uncontrolled field, that it doesn't make any sense to because he would not be able to understand it. Otherwise, it would be controllable. So it is written in the book. So someone typed in the sentence, a person would change his behavior if he could. If he cannot do so, I cannot expect that he would do so. And that is especially true for people who can't communicate it. So what are the stress reactions in relation to this being able to express something? So the stress reactions they have a means of develop themselves which is not accepted socially. There are many things which I look back on my professional practice, which I would like to do differently. So once again, is it a disorder, or should we rather speak about a reaction? All of you who have occupied yourself with trauma, that we talk about the post-traumatic stress disorder, that We have to observe symptoms on many different levels, not just the immediate stress reaction. There's also an accumulation of symptoms. And there the human being is, as ever, very inventive. So children have who has ADSD or standing in a particular spectrum and so on. All this we should, however, keep in the background, look at the biographical breaks which occur, and in this sense, look at in terms of the consequence of trauma. So disorders lead there too. And a very important point which has been found in the 90s is to look at the brain, our whole nervous system in relation to stress and stress experiences. So it has with these consequences. What we didn't know at the time, which opened our eyes to it, was the model of the threefold brain. So the hierarchical order of the three importance. So the large brain, the limbic system, and the small cerebellum. And of course, and also in a hierarchical order, that they're all, of course, very strongly connected with each other. But it's important for us to know that under extreme stress, this relationship inverts, so that the cognitive, the understanding, the noting and the associating, that when it's under great stress comes third. So when the person is under great stress in the uncontrolled area, then this whole order is turned upside down, and the so the control is given to the cerebellum, to the lower brain, this realm in which various automatic process of our organism take place. When you wake up in the morning, you don't need to think about the metabolism which is going on, because that is something which is all taken care for by the cerebellum, if you like. And the same way it is that the it doesn't make any sense to think about very carefully about all the kind of hormones that might be released. You just have to leave it to organize it. And what was important for us pedagogically at this point was the recognition that the solution in that we are releasing more stress to bring, if I bring him into such a situation to have to deal and explain their own behavior. So an important knowledge which which has been propagated in this concept to actually give oneself time and not go straight into and react to a particular situation, but in this place to create the space, so that I have thought of it and will come back to it later, rather than simply trying to create even more stress and make them responsible for it. So, a colleague from mine which actually pointed to the fact that the core of traumatization is actually extreme loneliness and abandonment. And that is an experience which many people who are affected have made. That it is a trauma of violence that always has a traumatization of relationships and the ability to make relationships. A loving relationship, which in many cases is simply certain and safe, is absolutely essential in order to overcome the trauma. That sounds so simple, but that is the challenge. A traumatized person is in danger of trying to come out of this difficulty too quickly. So a colleague from Basel relate to about home children have found that that came to an end not because they were successful, because they have failed all the interventions in the first years. If we think about this, when we think of 100,000 children in institutions, then 20% is simply far too many. So the question is in the relation to disability. So pedagogical institutions whose care problems fail, then they have a high risk of making the experience that they react, that they exclude, they try to keep out the person seeking to help them. I don't know how it is. So we should we develop our connection to in our knowledge with the disabled. So I learned that every child every form of child behavior is highly meaningful for that child, not for the adult, but for the individual child is highly relevant and meaningful, and it is a consequence of their own logic of development in their own biography. I must say that this sentence was not very easy. I actually had to learn many young people with behavioral difficulties, which my understanding of meaningfulness I had to really grapple with. So it wasn't immediately obvious. But I can, after 30 years, I can say that this sentence is actually true. If I don't understand the meaning of it, then it is because I've not yet grasped it. That means it's an important task for me as an educator. I link onto a process of understanding in which the human being tries to find his place in the world. When every behavior is addressed, it's all about finding understanding. And also what is verbally communicable and what is of behavioral communication, and how much simpler it would be if, as I see it, if we would actually observe the behavior of a person as a communication emissary, as a means to have agreement or non-agreement. And that appears on the level of behavior. And then we should actually arrange our educational input orientated around this. If trauma's got to do something with stress, so what is the, so that means that all the resistance which is there has a potential risk of causing more stress. What is observed, the more active is the stress system of that person and be overstimulated. That means that the tension when a person go into an emergency situation, this becomes ever smaller. So in our educational work, then we must try to reduce stress at every stage. That does not mean setting greater demands or challenges or letting them drop. It's often said that you're just trying to be too soft, but no. But my colleague has said that it's rather contrary to that, because I have to go through this process of understanding in order to make decisions as to what I can offer to him or her in order to reduce the stress. And for that, it needs a lot of creativity. And the wonderful thing is that in the educational work, that one doesn't come into stress or into panic. Then we can start using some of the other alphabet letters, you could say. So this is what makes the educational work so interesting and exciting. So if we look at the educational practice a little bit. So in the 90s, we began to work with trauma education. We didn't have anything as an example. So we then worked strongly with trauma therapy concepts to try to copy things. And now, of course, the trauma question has become an important and valuable independent training. So the first task which we have in order to reduce stress, the very first task is, of course, to stabilize, the stabilization. To develop a sense is going on the path into this uncontrolled realm to reduce stress. And what can we offer them? That can simply be a movement exercise. It can be so breathing exercises. So the most simple possibilities for developing one's autonomous nervous system and to calm it down. So little possibilities to stabilize, because the stabilizing is what so that the person himself can begin to start processing their experiences and to make contacts. And then I go further, the actual recreation of the possibility for having dialogue. And this, of course, in trauma, this is damaged. How the people in various levels who have no connection. That means the ability of staying in dialogue. The capacity of working with a person and remaining in dialogue with them is a second great challenge. So trauma reduces this dialogue capacity massively. It is not only in the speaking center, but also a lack of abilities to continue. So through that, a condition arises of meaninglessness, and one wants to come into contact. Every person communicates, and also in differentiated ways. And my task is to open this communication channel and this form of communication
Ich habe mit einer jungen Frau vor vielen Jahren gearbeitet, die konnte dialogisch sich nur mitteilen über Atmung.
And this can be communicated via breathing. When that was then understood, then lots of things became possible, in which we can learn to breathe again properly. I don't know if you know the work of this English person who for years was working with body language. So, for example, with people with strong artistic tendencies, that rhythm plays an enormous role via rhythm and dialogue, via touching and bodily contact, and awareness of the person opposite. That is how dialogue aspects can really be used and to build this up again. And then this, in the end, makes it possible to participate again in society and develop one's own individual perspectives. This is, of course, a very individual level. And our task is to really allow these individual aspects to develop. A solution which always comes towards us is that the importance of a processing of trauma techniques consists not but actually consists in a real social context with true social relationships. We have to expand on this, of course. It is not only a shared offering from the person, the primary person. It also has to be experienced. It is not only from the emotional condition, but it must also be experienced on a daily level, daily basis, so that it can come to this result. So in the trauma educational work, this sentence is primary. Before you start educating, you must have a relationship. What we've done here in this process is that so behavior should be, this behavior should disappear and so on. So all this is, if you try to prevent a certain activity, to get rid of it or so on, then they will certainly come back from two other places. That is that we must come into an understanding process. And otherwise they will go into another process where there are alternative behavioral strategies, which then becomes even more disturbing. And that means the best possibilities for it's certainly that the experience can become more concrete and more personal in the human relationships. So I don't have to be around all day long with these persons, but it is sufficient to be there just perhaps for an hour or two. But the experience must be made.
Der Begriff Erziehung ja auch suggeriert, irgendwo hinziehen will, irgendwo hinbringen will. Entschuldigung. Bevor diese Erfahrung nicht gemacht wurde,
Still this experience is made. These people, it will fall back into its old situation. And then reminding once more on the sentence, if a person, when he's at the stage where he can't do something, he needs some support. And in the trauma education, we are offering relationships so that they can actually achieve their own goals, ultimately without support. That means to form developing being present for them. I show them with my presence, I show myself as a person who has a fine sense of feeling, who gives signals to really organize and order, to move not like something as a kind of repressive measures, but to bring this offering, which is then in the situation to support the regulating of stress. So not only to offer something in order to bring the stress down, but to be in a position to reduce one's own stress system in such a way that one can control it oneself. We are always relating to the stress system of the other person. That means that nothing more exciting than that the two persons find themselves in the uncontrolled stress situation. So the question is then, what do I need for myself on this position? And not simply asking in order that so I can be a co-regulator of someone else. And that, of course, reveals itself in the in the reaction and resonance of the discussion. In the differences of the different communication channels that exist, which I've referred to before, which are then through which I'm then be able to develop this closeness, comfort, and bodily contact. So this is a theme which in Germany has been discussed in relation to all these abuse scandals. But what we see with that this connection becomes even more deeper when it is connected with the experience of bodily contact. So, for instance, of hand on the shoulder. And that this is the best way of encouraging it's far better than cortisone as a stress dampener. And that means that so it's not about keeping a distance to the various patients, but having a professional closeness or wanting to. And that becomes clear over time that a person whose stress system is a compromised area in the controllables area, but then when their demands are placed on them, this comes to the point, goes over the boundary, and then you have the symptoms of behavior arise, not wanted, not directed, but through the working together of our autonomous system. So it just shows with this graph how quickly this can rise up beyond that boundary through excessive demands, which from our point of view may be insignificant demands. That means that we need to first of all stabilize, to bring this onto such a level that where we can see as the task of our educational work. And it is not only about massive, great concepts and so on of how to work with this, but it is about everyday life. How does a human being relate in his daily life so that he's able, out in a controlled way, to come back into the safe zone? So through the demands, without having to leave into this high stress zone. And that, of course, is something which can easily get lost because it reveals itself in helplessness. So in this area of experience, then we can see where the demands can be brought in a controlled way. So the more we can raise the green area, then real growth can take place. And then I have a real counter force there in my hands. I've got a couple of minutes still. An important thought I would like to pick up here, that we, from the descriptions of behavior of a human being, we're then trying to understand it. That is what has a significance. My colleague from Hanau has said, you never ask a person how this was done, but instead, why have you done this? Because. So it opens up clarifications. The question, why, when I ask the question, I'm always very quickly in a defensive situation. And the word because keeps it much more open. Then they can go more into one or the other possibilities.
Deutlich auf Körperreaktionen achten. Wie gesagt, auf Zustimmungs- oder Ablehnungsreaktionen.
So it doesn't bring about all kind of avoidance, but coming to certain behavioral patterns. And a further possibility is that the 3 Bs. So we need to observe, which is the first B, observe behavior. We mustn't come too quickly to judge. So first of all, to observe. And what we've often missed out is to recognize the need behind it. The second B, the need behind it.
ein Kind, was sich einen imaginären Gefährten, das machen viele Kinder ja in einer frühen Entwicklungsphase aber wenn das anhält zum Beispiel, sich einen imaginären Gefährten schafft, mit dem er Selbstgespräche führt, dann ist das nicht pathologisch, sondern dann ist das ein Beispiel dafür.
So it's not necessarily pathological that the person simply has a need to express that I feel lonely, I need somebody to support me. And that means that that from my professional work, I can learn what these needs are and respond appropriately. In many cases, that then the evaluation, the third B, is then necessary and then simply to see, was it helpful? And then the lad said, no, it was not helpful. Then we've got a common theme to see what it could become. So one further thought, never let us forget that in this work, that it needs a good self-knowledge to look after oneself. Trauma does something to us. It burdens us and challenges us. Make sure that you, in these 4 areas, you are well prepared. What can I do for myself in order to care for myself so that I can do what does it need in the physical realm, also in the psychic, and in the also as helpers in the professional realm. What do we need to care for oneself? We easily can go beyond our own individual boundaries, that we have to really look, how can I be well positioned in these 4 fields in order to have my own protection for myself with these hugely demanding challenges when working with trauma education. Perhaps I need to have a replacement nerve. So I would just like to recommend a few books from psychotraumatology. These should be present in all the library shelves of every working team. Also for the work with young people, they give all these complex indications. It's written in there, and many other things as well, very practical things. And on the other side, this Swedish psychologist, I think, is also very inclusive about preventing challenging behavior, it's called. Very highly recommended. Thank you very much for your attention.